Hi, I'm Steve, and I'd like to introduce you to MedVision's Leonardo. Leonardo is a high-fidelity patient simulator. It's feature-rich and intuitive to use. The realistic appearance of the simulator is a massive benefit. Leonardo is 1.8 metres tall and weighs 60 kilograms, replicating that of an adult. Part of the features of Leonardo is realistic hair. As you can see, it's real, he's got realistic eyebrows, and he's got the features to represent an adult. But he also has realistic ears, which is really useful for even attaching something simple as a nasal spec or an oxygen mask. Nose, mouth, and you can see here that we can perform jaw thrusts, which is really useful, and we can do head tilt chin lift. And his head moves in a whole range of motions, and it's heavy, realistic of an adult. The simulator can be used as both a male and a female, so it has interchangeable genitalia. This obviously allows us to replicate both male and female conditions, which is important for student experiences. The airway of the Leonardo has been designed to be as realistic as possible and to be able to be used with a whole range of different airway adjuncts. Here I'm using a bag valve mask to provide bag valve mask ventilation. Because of the angle of the jaw and the realistic features of the Leonardo, I can maintain that airway and provide effective ventilation. We can swell his tongue, we can give him pharyngeal obstruction, but we can also give him laryngospasm, which will make his airway management more complicated to manage. His breathing can be controlled in a spontaneous fashion, giving you a wide range of respiratory rates. We can increase resistance and decrease compliance of chest, therefore making it more difficult to ventilate him. So we can also add in cyanosis. You can see the cyanosis under his nose, but you can also see it under his lips when I pull his lips back there. And he also has cyanosis in his fingers. This will enhance the learner experience and also gives indications of deterioration. Leonardo has spontaneous breathing. As you can see, my hands will move up and down, and we can alter the respiratory rate, make it very slow or very fast, or indeed just keep it normal. Leonardo has many auscultation points across his chest for both respiratory, cardiac and bowel sounds. 5 anterior respiratory sounds, 5 for cardiac and 4 for bowel, as well as 6 posterior sounds for respiratory. The use of the smart scope enables the learner to really focus in on the auscultation sounds they are expected to hear. There is no background noises, and this will enhance the learner experience. Moving on to circulation, Leonardo has 14 areas for taking a pulse. 2 carotid, 2 brachial, 2 radial, 2 femoral, 2 popliteal, 2 pedal, and 2 posterior tibialis. You can also take a manual blood pressure using the blood pressure cuff provided. We can alter the character and the rate of the pulse. We can also remove pulses from different areas should they be required. Again, the cyanosis will give indications of poor perfusion. As well as pulses, we can also attach real clinical equipment to simulate an ECG. So we can attach him to a cardiac monitor, and with use of the instructor application, we can alter his rhythms. We can use a real clinical defibrillator with real energy. This again replicates what we would expect the student to be able to perform in clinical practice. Everybody stand clear.
Perform CPR.
We're now going to perform some CPR, and what you'll see on the patient monitor is that we also have a CPR meter that's built in, that's looking at rate, depth, recoil and hand position. Looking at disability, we can alter the size of the pupils, we can make them dilated, constricted and or reactive to light. This can be done bilaterally or unilaterally. Leonardo can have trismus and convulsions to simulate a fitting patient. A tonic convulsion or a clonic convulsion. One of the great features of Leonardo are that he has secretions. So he can sweat, cry, have fluid coming from his ears, his nose, and his mouth, as well as being able to urinate. So one of the big advantages of using Leonardo is it has fully articulating limbs. This enables us to be able to position the simulator in a multitude of different positions, including the prone position for ventilation, which is very, very important should the patient need to be put on their front. And the weight of him means that they have to do it in a realistic fashion, using the correct amount of people to turn. Leonardo has an intravenous cannula, and with the use of RFID tags, you can actually give a simulated drug, and Leonardo can have a pharmacological response to that drug. You can also override that and allow you to give the response that you feel is appropriate. He has an intraosseous site for intraosseous injection on his left tibia. An advantage of Leonardo is that he has a separate wireless Wi-Fi router. This increases stability, enabling you to have confidence that you will not lose connection. So we have two monitors. One is the instructor application, which is obviously where we drive the simulator from, and then the other one is a simulated patient monitor. And again, we can make that as simple or as complicated as required. The instructor interface for Leonardo and for all MedVision products is designed to be intuitive and easy to use. We can go to our connections button. This is really, really useful. Anything that has a tick next to it is connected into our network, allowing us to check before we start a scenario. The other advantage for this is it also gives you an idea of the percentage of battery life in these three particular items. If I just open up one of the scenarios here, in the automated scenarios, what you can see here is there is a library of pre-written scenarios for you to use, and that has associated descriptions and learning objectives which open up. Manual scenarios have the same titles but are only the opening box, and then themes allow you to create different themes and patterns. What I'm going to do for the purposes of this demonstration is I'm just going to open a healthy patient just to show you what the interface looks like as we begin a scenario. What you can see here is a panel called Fast Transfers, and this allows us to preempt some conditions and some physiology, and then to basically activate that physiology if we wish to. When we look at this middle panel here, this is to control anything functional on the Leonardo. This panel here is for physiology and to change rates and trends and transitions. We have an action log in the bottom right hand corner here, which will tell us what we're doing, when we're doing, if we're listening, if we're feeling. We have a CPR monitor. We can measure depth and recoil, rate, hand position. If we ventilate, we'll also get a volume there, and if we defibrillate, we'll get a number of shocks. We have a waiting rhythm, so we can actually preempt when we would like the rhythm to change. In this circumstance, it's in sinus rhythm. We could alter that, create a scenario so it will only convert after 2 correct shocks, delivering at the correct energy. And we also have the facility here to pace. And then we have sensors, so we can activate the patient monitor sensors from here, so we can override. If candidates haven't added any parameters onto their patient monitor, we can add that for them. If we want to generate any patient words, we can do that simply by pressing the words icon. We have these prescribed patient words, so there is quite a comprehensive library, and he can say words like
yes
and
no.
Additionally, we can add a headset into this, and we can actually speak through the Bluetooth speaker in Leonardo's head, and therefore we can have two-way conversation quite easily.
No, I don't have any cardiac problems. Thank you.
So in here we have the brain, and this is where we find the trismus, and we can also activate the convulsions very simply by just pressing the yes button, and the simulator will convulse. And we click no, and that will stop. Airway, if we open it up, we can see this is where we have our tongue edema, tongue fallback, and then we can add in the more difficult airway procedures such as pharyngeal obstruction and laryngospasm. Into lungs, this is where we can increase the resistance in either lung and decrease the compliance. So therefore the airway pressures will rise accordingly, and you will go from normal airway pressures to very abnormal airway pressures and everything in between. We can have left and right tension pneumothorax, and we can actually decompress the chest on Leonardo in the second intercostal space in the mid-clavicular line. Leonardo also has a bleeding module, so he has two tanks built within him, one to carry fluids and one for his bleeding modules. And these bleeding modules are attached, and then you can control the bleeding with the scroll here, and you get active bleeding and you can stop it as well. Moving up onto the right, you can see eyes. So this is where we can control the eye movement, closed, half open, dilated, not reacting to light. These are linked with this padlock here. If I unlink them, I can then use each eye independently. We can change the pulses manually. They will also alter automatically as you change the physiology using this panel here. But also we can also override the cyanosis to create that cyanosis if we wish to. It will automatically be generated below 80% SpO2. When we come to auscultation, we would use the smart scope to auscultate the chest. And this is our library for different pathologies and different heart sounds, bowel sounds and breath sounds. We can click that so that both lungs are linked together, so both areas will have the same, our extensive library of respiratory sounds there. We can actually go into the zones and we can create the actual abnormality in the particular area that we wish to have it. So if we look at the heart, we have 5 auscultation points, but what we could actually do is create the mitral valve with a mitral valve stenosis. And click activate. And in the mitral valve now, when they auscultate, they will hear a mitral valve stenosis. The beauty of that is in all of the other valves, it will be associated with a mitral valve stenosis, but may well sound normal. And we can do that for heart sounds, bowel sounds, and breath sounds, both anteriorly and posteriorly. We can also turn the volume in particular lobes and zones down, so you can have a diminished air entry in the right lower lobe, and you could have a crackles there, and everything else could be normal. So our final icon is secretions, and again they're just activated by yes and no. When we go over to the more physiology side, we can change that monitor layout very easily by having pre-written monitor settings, and you have the flexibility to create your own monitoring layout to fit your need. We can pause and activate alarms, and we can actually create the alarm limits that we wish to from this icon here at the top. We can increase the rate just by hovering over it and with our mouse just wheeling over it, or we can click on and we can create this to go higher. We can delay the onset, and we can also give that a transition time. So we can do it far more gently and far more realistically than previously available. If we want to change the appearance of the ECG or rhythm, we just click on there, and you can select the arrhythmia of your choice and even alter the rate, apply extra systoles, apply electrical and muscular artifact, and obviously you can also override all of these arrhythmias and create a PEA arrest. If we create a cardiac arrest now, what you can see here is that we have these blue icons. You can see that things have changed, and we can bring that CO2 down gently, and now we have a cardiac arrest. So if we start to perform CPR, what will happen is this will activate, and you'll see this icon will start to move as the candidate performs their CPR. So that's a general whistle-stop tour of the user interface. It's extremely simple to use, very little training, and once you've sort of navigated yourself around, it becomes very self-explanatory. What we'll do now is we will now move on to the patient monitor to show you some of the features and functions that you can display for your candidates to view. So as you can see, this monitor layout is representative of the instructor one. So whatever I see, the candidate will see. Change your parameters on the instructor application and they are replicated within the patient monitor. There are some quite unique features for Leonardo. You can have the alarms on and off, so they're currently off. See, we've got some abnormal outside of the limits that are set. We can pause that alarm for 2 minutes, or we can switch that alarm off. We can measure a non-invasive blood pressure, and we can actually get the volume as well for that blood pressure. and that sounds like the clinical piece of equipment taking that. We've got this set on an automatic cycle every 1 minute. We can change that up to every 5 minutes or have it on manual if we wish to. We can measure the train of force, so if you're thinking about anaesthesia scenarios, that will be a function that's available. And we can generate a 12-lead ECG from the rhythm that we have activated on our scenario. So as you can see, when I press that, we get this ECG, and it's very accurate. It even has the rhythm strip along the bottom to allow you to calculate rate, etc. We can print that ECG off to allow the students and candidates to investigate the ECG even further. We spoke about giving drugs via the intravenous route. We can also give a drug in a virtual fashion using this function here. So we can select the drug, we can select the route, the concentration, and we can also then select the volume, and then we will give that drug in a virtual fashion. As you see there, you may see it says pharm. So this, in this scenario, the simulator would have a pharmacological response to that drug. For defibrillation, you've seen that we can use live defibrillators, but we also, in this patient monitor, have the ability to deliver a virtual shock. So therefore, if you don't have that facility available, you can still shock your patient and your simulator in the same way as you did with the clinical piece of equipment. And you can also pace using this function as well. In this scenario, we've also prescribed some information. So in patient data, you can see there is a little bit of symptoms and treatment of this particular scenario. Also have some high resolution images that you can display. Not only can we provide images, but we can also provide small pieces of video that can assist them in their management of the simulator. We have a CPR monitor on or off. So we saw on the instructor application how the CPR is displayed. If we do some CPR now with this button switched on, we will also get that same data on this patient monitor, again aiding that student sort of learning curve and allowing them to adapt their performance with the metrics that it's being provided. And then finally, we have the sound on or off. So now we will have no sounds at all. So the patient monitor, very clear, very intuitive. It sort of lends itself to a whole range of different clinical teaching. Anybody really who's undertaking any healthcare studies, both undergraduate and postgraduate, so it can be used right through to senior clinicians, meaning that the simulator will be used in more environments with more teaching and hopefully improving patient outcomes as a result of the training. For more information, please visit our website www.mse-group.co.